Welcome, everyone. I'm Dr. Bridget Taylor, co-founder and CEO of Alpine Learning Group. Welcome to Alpine Learning Group's Innovation in Autism webinar series. Alpine Learning Group offers a full range of diagnostic and applied behavior analysis, educational, and clinical services to individuals of all ages. Each year, during Autism Acceptance Month, we share our expertise through free webinars and make them available to the community. I'm thrilled that this year, the webinar series is presented in partnership with Autism New Jersey, a nonprofit agency committed to ensuring safe and fulfilling lives for individuals with autism, their families, and the professionals who support them. Today's webinar is Don't Wait, Evaluate: What to Expect from an Autism Diagnostic Evaluation and What to Do Next. At the close of this presentation, we will share a QR code to learn about other presentations in this series. For nearly 35 years, I've had the pleasure of working alongside a group of innovative and compassionate leaders in the field of autism. I'm happy we're able to share their expertise with you here today. And with that, I'm very excited to introduce Dr. Jaime DeQuinzio, Alpine's child psychologist, who will share information for parents and caregivers all about the diagnostic process, and Lauren Frederick, who will speak on Autism New Jersey's timely diagnostic initiative aimed at combating barriers to autistic evaluations. Jaime, take it away.
Thank you, Bridget. So here's our agenda for today. I'm very excited to talk with you about this topic. I'm going to cover common questions that parents and caregivers have regarding an autism diagnosis. Then I'd like to share some information from the Centers for Disease Control and Prevention, their Autism and Developmental Disabilities Monitoring Network, or the ADDM. And this is going to provide important information and a relevant backdrop for our conversation today. I'm going to discuss some early signs of autism very briefly, just to help parents and caregivers to determine if their child needs an autism evaluation. I'm going to spend a good amount of time today going over the actual process of diagnosing autism and just really practical information for parents and caregivers so they know what to expect. I'll cover what to do after the evaluation. We have some really nice resources on what to do while waiting for an evaluation, or if you've already had an evaluation and you're waiting for services. And then Lauren Frederick, as Dr. Taylor announced, will discuss Autism New Jersey's Timely Diagnosis Initiative. And Lauren, unfortunately, could not be here today, so she recorded her part of the presentation, and I will share that with you near the end. Finally, we will have an opportunity for questions, and I'm happy to answer any questions that you have. So let's get started. When I talk with parents and consumers and really just the general public, there is a lot of confusion about this topic, just about the diagnostic process in general. How is autism diagnosed? It can be a confusing and complex process, and often there are many, many questions. Parents and caregivers usually wonder, well, who can diagnose autism? How do I get started getting my child evaluated? What does an evaluation consist of? What happens during an evaluation, and what can I expect? What characteristics of autism can be tested, and how are they tested? What information do I get from an evaluation? What's the cost? And what do I do after the evaluation? And the majority of these questions will be the focus of our presentation today. There's also worry. Parents and caregivers express worry about the diagnostic process in general, and then what comes along with having a diagnosis of autism. They're often worried about cost and what kinds of therapies, what the school program might look like, and just overall what the future might hold for their child. Sometimes these worries might delay an evaluation, along with other factors such as cost or other people telling parents to wait. What I'm here to say today is don't wait. And what we want to do today is share resources with you that I hope will be helpful in helping you making that decision not to wait. It's well known that an early diagnosis leads to early intervention, which improves long-term outcomes. I want to start by sharing some data on autism in the United States from the CDC. This information is available to everyone. It's on the CDC website. This will help you stay informed about many factors related to autism. I'm just going to share a little bit of this information today to get us started and also to provide a relevant backdrop for some of the things we'll be discussing. According to estimates from the CDC's Autism and Developmental Disabilities Monitoring Network, the ADDM, in 2020, as well as their Morbidity and Mortality Weekly Report, the MMWR, in March of 2023, for 2020, nationally, about 1 in 36 8-year-old children have been identified with autism spectrum disorder. These estimates are higher than previous ADDM network estimates during the 2000 and 2018. Autism is reported to occur in all racial, ethnic, and socioeconomic groups. However, for the first time in 2020, the percentage of 8-year-old Asian or Pacific Islander, Hispanic, and Black children identified with ASD was higher than among 8-year-old white children. That's for the first time since 2000 when they started collecting these data. These shifts could reflect improved screening and awareness and access to services among historically underserved groups. Also, important to note, since the first ADDM reporting period in 2000, ASD prevalence has been higher among boys than girls across all of the sites where they collect these data. So that has not changed at all. It is 3 to 4 times higher in boys. At this time, there's really no clear explanation for this difference. One consideration is that boys might be at greater risk for developing autism for some reasons that are just unknown at this time. Another consideration is that autism can have different signs and symptoms in boys versus girls, or different severities, or different progression of the expression of those symptoms. This can contribute to differences in how autism is identified and diagnosed and then reported. And what I think is really most relevant to our talk today are these numbers. This is the average age of diagnosis. It is 49 months, and that's just a little older than 4 years. It's actually lower if the child has an intellectual disability, and it's much later for underserved populations. Now, if you think about this, 4 years old is relatively old when it comes to diagnosing a neurodevelopmental disorder, something that develops and starts to show signs early on and over the first few years of life, and a disorder that can be diagnosed reliably between 18 and 24 months. It can be diagnosed as young as 12 months when more profound symptoms are presented and when there's a history. So, for example, an older sibling with autism. Related to family history, we know that for siblings, the prevalence is 1 in 5, and that's a 20% risk. So if you have a child with autism already, there's a 20% risk that the other children will have autism. So the point here is that get your younger children screened and evaluated as soon as possible. Don't wait. Now let's zoom into our home state of New Jersey. What did the numbers look like here? These findings are from the CDC's New Jersey Autism Study, or the NJAS. These numbers help us understand more about the number of children with autism and the age at which they were first evaluated and diagnosed. Again, also relevant to our conversation today. So if you look at the prevalence rates in New Jersey, it's 1 in 35 8-year-olds. They were diagnosed with autism, and these numbers are from 2020. And as you can see by that horizontal dashed line, that's the national average. New Jersey is that purple bar, and we're just above the national average. They also have numbers on 4-year-olds. So 2.5% of 4-year-olds were identified with having autism. And again, if you look at the blue bar, that represents New Jersey. We are just above that overall national average of 2.2%, represented by the vertical dashed line. Okay, so in both cases, 8-year-olds and 4-year-olds, New Jersey is just above the national average. I thought these numbers were also interesting. The ability to evaluate children for autism was certainly affected by COVID-19. The New Jersey Autism Study by the CDC also reported on this. Before the pandemic, 4-year-old children had higher autism identification than 8-year-old children had when they were 4 years old. And now during the pandemic, so they have these numbers from the first few months of the pandemic, that changed. 4-year-old children were then less likely to have that evaluation done when compared to their 8-year-old counterparts. So unfortunately, the pandemic did influence diagnoses, and there were delays to people getting diagnoses, and people were forced to wait. Now, this is likely another reason we have such a bottleneck happening right now for getting an evaluation. Still today at our diagnostic clinic at Alpine Learning Group, we have families coming in who waited during the pandemic. Their children are now 4, 5, and 6 years old, and they're just being evaluated for the first time. So this is also due to combined effects of wait lists for evaluations. And later on, Lauren from Autism New Jersey will discuss additional reasons for those long wait lists when we see her later on. There are also many factors and variables related to autism and the diagnosis of autism that we unfortunately won't be able to cover today. But what I did want to do here is mention them because they are central to discussions on what is happening in this ever-changing context of diagnosing autism. These topics include racial and ethnic disparities, socioeconomic disparities, diagnosing autism in females and in adults, why the prevalence rate continues to increase, co-occurring diagnoses and how those are diagnosed, genetics in autism, biomarkers and their involvement in diagnosing autism. So there's a lot of exciting research happening, and it's just important to keep in mind that things are changing and constantly changing, and there's a lot of variability happening right now in the field. My focus today and our focus today moving forward is just more general and practical information that is applicable for all families looking for an autism evaluation. I also wanted to mention just on the right here, I did list just some resources if you are interested in reading a little bit more about these other factors and these other topics related to autism diagnosis. You can certainly access the CDC, and I've provided those resources on the prior slides in terms of QR codes and websites. I do encourage families, to look through scientific journals or, in a quick web search, if you looked up any of these scientific journals, I just listed a few here that had some articles related to these issues. You can find resources that are science-based. And then any information about genetics and autism, the Simons Foundation is an excellent resource there. Okay, let's shift now and start to chip away at some of those important questions. Many parents and caregivers begin with wondering if their child requires an evaluation and what to look for. If you are seeing any of these signs, you should move forward with an evaluation. So it's hard to get your child to look at you or to share enjoyment with you. Your child rarely responds to others or when their name is called. Your child is more interested in objects than people. Your child has unusual ways of moving their bodies or interacting with toys. Your child has unusual reactions to sounds, sights, or textures. That's either seeking them out or an unusual response, so maybe avoiding those things. They may have trouble communicating their wants and needs. Any excessive rigidity or resistance to changes or insistence on certain routines, and or extreme behavior like tantrum behavior in and around those routines. Those are all signs that you want to have an evaluation right away. Other signs I like to stress with parents is any loss of skills they once had. So, for example, they used to imitate, but now they don't. Or they used to say mama or dada or cookie, and now they don't. Also, you want to look for a plateau in development. So, for example, development was progressing and then it just stopped and stayed stagnant. All of these situations, you want to seek an evaluation. Now, there are also some tools that can help you make this determination, whether or not you need an evaluation. And these are called screeners. There's one very well known, many of you may already be aware of. That's the MCHAT, the Modified Checklist for Autism in Toddlers. It's something quick you can do online. I included the QR code here. I often provide this resource to families. The outcome includes the risk level for autism, and that lets you know whether you should pursue an evaluation. It also just gives you some structure, gives you some points to review with your pediatrician. You can use this as early as 16 months. Now, the American Academy of Pediatrics does recommend that pediatricians screen for autism at 18 months and at 24 months. Also, anytime a parent raises a concern. But just so you know, you can start answering these questions at 16 months, so even earlier. Here's another tool, a really great screening. This is one of my favorites. It's called 16 by 16 by the Baby Navigator. And after you just register very quickly, you can do a social and communication screening with your baby. This is the actual list of the 16 signs for autism included in the Autism Navigator. So I'll just give you a moment to look at those. I won't read through them all. I did highlight a few in the prior slides. Okay, so you've done some screenings. You're ready to talk with your pediatrician. And really, your pediatrician is the professional that sees your child regularly throughout early development. And that is your first point of contact if you have a concern. Don't wait. Don't wait to share your concerns with your pediatrician, especially if there's a family history of autism. Don't wait if your pediatrician notices some signs first in one of their evaluations and brings that concern to you. Act on their recommendations. My main point to stress here is that if you are concerned about your child's development and autism specifically, you move forward with getting your child evaluated. If you have concerns, nobody should tell you to wait. So who can diagnose autism? Who do you go to? Who are the professionals or specialists you should be seeking out? Well, in the left column here, we have medical doctors. And you'll see on this list, the most common clinician that diagnoses autism are developmental pediatricians. You'll also see pediatricians. Yes, some pediatricians can diagnose autism, most do not. Later on, Lauren from Autism New Jersey will provide more information on their initiatives related to pediatricians. Your pediatrician might make a referral to another medical doctor for a diagnosis. For example, a pediatric neurologist, a child psychiatrist. Some nurse practitioners working under medical doctors or in medical practices are starting to do this as well. Um, maybe your insurance requires a referral by a medical doctor, but not all insurance does require that. And you'll see on the right other professionals who can make diagnoses of autism as well. And these are doctoral level clinicians. These are psychologists, either with the credentials PhD or PsyD, and they are licensed to practice psychology. So I have there as the first credential listed there, licensed psychologist. But they may have a variety of titles within their practice: child psychologist, developmental psychologist, clinical psychologist, or neuropsychologist. If the term psychologist is there, they are and should be licensed. They can only use that term if they actually are licensed in the state to practice psychology. Now, some of these professionals take insurance and some don't. Again, it would be up to you as the consumer to determine whether your insurance provider requires a referral for these services, whether you can just go to them directly, whether they're an in-network cost or an out-of-network cost. This is information you really want to be informed about and get from your insurance company. So knowing your insurance benefits is really important at this point in the process. Now, there are other professionals who might participate in an autism evaluation and who can make up a multidisciplinary team evaluation. For example, a speech pathologist or speech and language pathologist, occupational therapists, social workers, and board-certified behavior analysts. All of these people can contribute important information towards a comprehensive evaluation. However, only medical professionals and psychologists can make the final determination of an autism diagnosis. There are no medical tests to diagnose autism. A diagnosis is based on clinical judgments. So, this judgment is made by people who are experienced and who are knowledgeable and who use a variety of tools to assess an individual. There is no one single measure to diagnose autism. And the reason I mention this and stress this is because there is some misinformation out there that one specific test is required to make an autism diagnosis. It's called the ADOS, and that simply is not true. Again, any one assessment is just one tool a clinician has in their toolbox. Now, the ADOS is considered by some the gold standard assessment. It's an excellent, excellent diagnostic tool, but it is never and should be never administered alone. Again, Lauren from Autism New Jersey will provide even more detail about this as it relates to access to services later on in the webinar. There's work being done with biomarkers like eye tracking and other, so that's a behavioral biomarker, but other biomarkers like neural biomarkers. Now, right now, those are considered additional tools. Not all clinicians have access to them. For those who do, it is just, again, one tool in a toolbox. So every clinician will do things a little bit differently. But what can you expect in order to prepare for the evaluation? So the first thing is sending records. So you want to make sure that you're compiling all the relevant records for the clinician to review. If your child is very young and it's their first evaluation, you might not have any records. But they could have medical records. If they're a little bit older, they could have records from other interventions, other service providers, and potentially other evaluations. You want to give yourself time to complete all the forms that were provided to you. Read through all of the correspondences. This is a very stressful time, right? And to recognize it's a stressful time for families. There's a lot of information. And on the day of the evaluation, you don't want to be worried or stressed about directions or where to park or how to get into a building. You also want to know what to bring, what to avoid bringing to an evaluation. Some clinicians are very specific about those things. So again, taking your time to read through all of the information. I mentioned this before, but it's worth mentioning again, knowing your insurance, what a coverage there might be or might not be, and any documentation that you might need to organize, bring with you to the appointment, or send prior to the appointment. You might also think about preparing a list of questions or specific information that you think is important to share with the clinician that you don't want to forget to ask or mention. Again, it's a stressful time, and during times like that, you might forget certain things that you thought were really important. So having something written down, also having something to write with so that you can take some notes, so that you can remember either directives or points that the clinician makes. You also want to make sure that everyone is well rested and healthy. Some evaluations are long, other evaluations are shorter. I'm going to cover this in a little bit. But if your appointment is scheduled for 2 or more hours, you'll really want to be prepared with whatever the child needs, right? Of course, this is going to depend on their age and their developmental level. Do you need to bring extra diapers? Do you need to bring foods or snacks? Something to keep them busy on a break. These are all things that you want to consider and think about ahead of time. So what should you expect during the evaluation? Well, a diagnosis is made based on structured observations and interactions. So at the very least, you should expect that the clinician will interact directly with you and your child, or ask you to interact with your child. They might administer standardized assessments, and this includes direct administration and interaction. These could also include caregiver or parent questionnaires, structured interviews with the parent or the caregiver. These could be provided or conducted right in the moment or provided ahead of time. They might send ahead of time teacher questionnaires. They will also look at your child's history. They might ask those questions right in the moment, or do a comprehensive records review prior to the appointment. These appointments could happen in person, right there in the office. They could happen remotely through video conferencing of some sort. There are some assessments that can only be used in person, and then there are some that can be done remotely. So during the evaluation, what exactly is the clinician looking for? Most clinicians are guided by the DSM-5 criteria, the Diagnostic and Statistical Manual of Mental Disorders. There are specific criteria for autism. Now, the symptoms that they're looking for, they can be occurring currently, or they could have occurred by history. They could have occurred in the past. So that's why the interview or the records review is a really important piece of an evaluation. So, looking at the first main category, social and communication deficits. Now, they're looking for persistent deficits in social communication and social interaction across contexts. And what they're looking to do is rule out ones that can be accounted for by just general developmental delays. So the way that happens is that all 3 of these criteria and deficits in social communication have to be present, currently or by history. So problems with social initiation and response, problems with nonverbal communication, and problems with social awareness and insight, as well as with the broader concept of social relationships. Now, you can imagine within each one of these categories, there are many, many behavioral examples. And what's important to keep in mind is that clinicians really try to avoid fitting more than one of these criteria with the same symptom. Really, it's one criteria should fit into one of these categories, right? So you don't, the child has one symptom, for example, lack of interest in others. That can't be used to account for all of these criteria. And remember, all 3 have to be checked. The next main category in an autism diagnostic evaluation is the presence of restrictive and repetitive behaviors. Now, there are 4 examples provided, 4 categories of symptoms. Only 2 of the 4 are required. So in addition to the 3 social and communication from the prior slide, an additional 2 from this category, restrictive and repetitive behaviors. And that includes atypical speech, movements, and play, preoccupation with objects or topics, rituals or resistance to change, and atypical sensory behaviors. Now, in each of these slides, I'm describing these categories more broadly, just so we're not getting weighed down with the language and the long language that is included in the DSM-5. Okay. Again, here, for each of these symptom categories, there can be a variety of examples of behavioral symptoms or what we call behavioral phenotypes that fit each one of these categories. The same rules apply. You cannot use one category, one description of a behavior to account for more than one of these symptoms and to meet these criteria. So what I just reviewed are the core autism symptoms, and clinicians can use a variety of assessments and procedures to determine the degree to which these symptoms are present. They get the developmental history through the structured or semi-structured interview, and they review records. Within this, they're asking questions about family history, medical history, pregnancy and post-pregnancy occurrences, all of the milestones, educational and intervention history, also the child's strengths and interests. They may also make behavioral observations when interacting with your child. And by watching your child play alone and by watching your child play with caregivers or family members. It might also happen that they might observe your child outside of the office. They also complete rating scales, and I'll just mention a few here. For example, a CARS or a GARS, social responsiveness scale, autism spectrum rating scale. There are some structured assessments like the ADOS, which we mentioned before, and the Vanderbilt Triad Autism Tool, which can be done remotely or in person. Again, these are just some examples of assessments that might be conducted just to determine those core autism symptoms. As you can see from this, there are a variety of ways in which a clinician will get this information. Now, they're also looking at some additional criteria to see if there are additional symptoms that are present in early childhood. So, are these symptoms present in early childhood? Because they might not become fully manifested until social demands increase or exceed what the child is capable of doing. Clinicians want to answer whether the symptoms together limit or impair everyday functioning. So they might do some additional assessment, right, to measure their adaptive behavior. Adaptive behavior is communication, daily living skills, socialization, and motor skills. Clinicians also might want to determine if the symptoms can be better accounted for by an intellectual disability, or if there is a co-occurring intellectual disability. So they might do an additional cognitive assessment or an overall developmental evaluation will help to answer some of these questions about the additional criteria related to an autism diagnosis. Severity level can also be determined in an evaluation. So there are 3 levels. Severity level 3 is requiring very substantial support. And severity level is assigned to both categories of symptoms, to social communication, that first category, and to restrictive and repetitive behaviors, the second category. So what does severity level 3 mean, requiring very substantial support? In terms of social communication, it means there are severe deficits in verbal and nonverbal social communication skills, and that these cause severe impairments in functioning. There's very limited initiation of social interactions, and there's really minimal response to social initiations from other people. What does severity level 3 look like for restrictive and repetitive behavior? Inflexibility of behavior and extreme difficulty coping with change, and the presence of other restrictive and repetitive behaviors that interfere with functioning in all domains across all spheres of functioning. There's also great distress and difficulty changing focus or changing action. So, for example, trying to stop those behaviors, or if those behaviors are interrupted in some way, there's extreme distress. So that's severity level 3 for both social communication and restrictive and repetitive behavior. Severity level 2, requiring substantial support. What that looks like for social communication are deficits in verbal and nonverbal social communication skills too. But these impairments are in place these impairments are apparent even when there are supports in place. There's very limited initiation of interaction. There's reduced or abnormal response to initiations by other people. In terms of restrictive and repetitive behaviors, what does severity level 2 look like? Inflexibility of behavior, difficulty coping with change, other restrictive and repetitive behaviors that appear frequently enough to be obvious to someone who's just a casual observer, and that they also interfere with functioning in a variety of contexts. And there could also be some distress or difficulty changing or reducing focus from those behaviors when there are attempts to redirect. And severity level 1 requires the least amounts of support. So this is just labeled requiring support. In terms of social communication, what this looks like is without supports in place, the deficits in social communication do cause noticeable impairments. There is difficulty initiating and responding to social interactions. But when social interactions occur, they seem atypical, they might be unsuccessful. They may appear to have decreased interest in social interactions. So for example, someone who might be able to speak in full sentences and engage in communication, but for some reason the communication and the conversation is awkward or often fails or is unsuccessful. In terms of restrictive and repetitive behaviors, what does this look like in severity level 1? Inflexibility of behavior, which causes significant interference with functioning in more than one context. There might be difficulty switching between activities. There might also be some challenges with organization or planning, which could interfere with independence. Now, sometimes evaluations are brief. And the goal of brief evaluations are really to fast track the child to intervention as soon as possible. And those are really important evaluations. Sometimes parents and caregivers want to seek a comprehensive evaluation. And a comprehensive evaluation will include a full picture of the child, including their strengths, their weaknesses across a variety of developmental domains, and really what I like to call like a deep dive into the autism-related symptoms and how those impact functioning. Now, even if you start with a brief evaluation, at some point, a comprehensive evaluation is a good idea. It's going to establish a baseline of all those skill domains, and it will allow you to have a point of comparison to assess yearly or every 2 years, and really be able to evaluate the impact of intervention over time and across a variety of areas of functioning. So those are the benefits to both. Now, what does these two types of information evaluations provide? What kind of information do they give you? In a brief evaluation, you're often getting a brief report as well. You're getting a report. You're getting the diagnostic determination. Sometimes they're able to give you a severity level, but sometimes they're not. The codes that are related to an autism diagnosis, and those are important for insurance. Treatment recommendations, although they might be more general. Referrals for additional evaluations, and of course, resources for the family, in either in the community or support services. With a comprehensive evaluation, you're getting a report as well, but it's a comprehensive summary of cognitive, language, social, emotional, and adaptive profile of the child. Although the reports do range, right? And could stress certain areas more than others. You're getting detailed information about the autism symptoms, usually in a comprehensive report. The diagnostic determination, of course, and usually the comprehensive reports are the ones in which you can determine a severity level more easily than in a brief evaluation. Co-occurring conditions, whether there's some differential diagnosis also, what additional diagnoses can be ruled in or ruled out. Detailed treatment recommendations that are often linked to the autism symptoms and other areas of developmental delay. Referrals for additional evaluations, and of course, resources. In both a brief and a comprehensive evaluation, you should expect as a consumer to have a feedback session and counseling regarding the diagnosis. You should expect that the clinician spends some time with you as the parent or the caregiver, explaining the diagnosis and answering your questions. So who's getting brief evaluations versus comprehensive evaluations? It's really about even. The CDC found that 58% of 8-year-old children who were identified with autism did have a comprehensive eval by the age of 3. So it's just a little more than half had a comprehensive eval. The others were more brief and still able to get the diagnosis. So it really depends on what you are looking for, and the kind of information you're looking for. But the most important factor is that the evaluation is a bridge to intervention, because that is the whole point, right? That is where you want to get to. So what steps should you take now that the evaluation has been completed? What you want to do is just follow those recommendations that the clinician makes as soon as possible. Jump into action. Make those phone calls, contact the service providers, follow up on the prescribed medically necessary interventions that the clinician included in their recommendations. You also may have been prescribed other specialized evaluations that maybe were not included in the evaluation you had, such as occupational therapy evaluation, a physical therapy evaluation, perhaps a separate speech and language evaluation. Medical evaluations, for example, hearing or vision tests, could have been recommended. You might also have to make other medical appointments. So, for example, if there's any concern about seizures or movement disorders such as Tourette's, you might have a follow-up appointment with a neurologist for an EEG. If there are sleeping or feeding problems, you might follow up with those specialists as well. Keep in mind, there can also be waiting lists for these services. Okay, so getting started as soon as possible will prevent too much delay. Most clinicians are also referring people for genetic testing. And because certain genetic phenotypes might have related associated medical conditions, and you'll want to know if there are any additional specialists that you would need to see. So that's why that's important. Those can be very expensive and they're not always covered by insurance. So I've included here a resource, the Simons Foundation. They have a program called Spark. And if you agree to be part of their clinical trials, you can get some of these genetic tests covered. So while you're waiting, whether you're waiting for a diagnostic, whether you have it and you're waiting for services, there are things you can do. Alpine Learning Group and Autism New Jersey both have excellent resources that you can access during this time. Alpine has a video library with a variety of topics to help parents and caregivers begin to intervene and to teach these skills themselves. So I've included the QR code here. Here are some of the topics from the past webinars that we've hosted. These are all available on our website. And so while you're waiting, you can just really use that time to your advantage. And now to talk more about wait lists and waiting and why there are wait lists and Autism New Jersey's timely diagnosis initiative related to this issue is Lauren Frederick. She's the Director of Clinical Initiatives from Autism New Jersey. So I'm going to advance now to the next slide, which has Lauren's pre-recorded webinar. If you could just turn up the volume on your computers just to make sure that you can hear everything. And I will get started with that now. So here's Lauren.
Many of you are probably aware that the waiting times for an autism evaluation appointment can be quite long. Right now, a recent national survey reported that nearly 2/3 of the centers that they surveyed had a waiting time of 4 months or more. And actually 16% of the centers had waiting lists either longer than a year or waiting lists that were so long they had simply stopped taking referrals altogether for the time being. Autism New Jersey often talks to families and healthcare providers throughout our state that confirm that New Jersey has similar issues. The waiting times to autism evaluation appointments with developmental behavioral pediatricians can range anywhere from several months all the way up to, for some reports, of 2 years. So unfortunately, families are having to wait quite a long time in order to get that appointment with a specialist to have the evaluation and see if their child does in fact have autism when they have concerns. So what are the reasons for these long wait lists? Several. First, increased awareness of autism spectrum disorder. Simply more people are seeking out evaluations for autism. Increased pediatrician screening. So this is a good thing. The American Academy of Pediatrics recommends that pediatricians do some type of formal screening, the MCHAT being the most common one, at certain points throughout a toddler's developmental stages. And more pediatricians are adhering to that recommendation. So this is a good thing that more pediatricians are connecting with families, having these conversations. But then with that increased screening comes increased notification to families that there may be an issue and they may want to look for a specialist appointment. Another reason is the lengthy evaluation and documentation process. So autism evaluations, as we're learning today, are oftentimes 1 to 2 hours across maybe, again, multiple visits. And then a pretty lengthy report and documentation comes out of that. So this is something that takes a lot of time for those who are able to diagnose. So this obviously just decreases the number of patients that someone could see. If a general practitioner is able to see patients in 15 to 20-minute clips, they can see dozens of patients a day. If a developmental behavioral pediatrician needs 2 hours with one patient, obviously they can only see a few patients a day. So this just cuts down on the number of appointments that are available. Most important reason why we're seeing these delays is that there is a workforce shortage. Right now, it's reported that there are 31 developmental behavioral pediatricians in New Jersey. Now, developmental behavioral pediatricians are obviously not the only people who can give an autism diagnosis to a child. However, they are the most common referrals that pediatricians will give, and there are simply just not enough of them to go around. So we can see that all 4 of these reasons combine together to make these lengthy wait lists. We have more people seeking it. We have more pediatricians screening and raising red flags that they need an evaluation. And there are fewer people doing the evaluations that take a long time to do. All of these things, unfortunately, result in pretty unacceptable wait times for autism evaluations. So here at Autism New Jersey, we recognize that this needs to change, and we're taking efforts in that manner. A formal autism diagnosis is required for insurance coverage of medically necessary treatment. So while there are interventions that you can receive prior to a diagnosis, such as early intervention, to get your insurance to cover several different types of medically necessary treatment, that formal diagnosis is needed. So it is important, and there's a delay to that diagnosis. These delays to diagnosis obviously then impact access to optimal treatment. This has many negative impacts. It obviously just causes frustration and worry for families. You see the clock ticking, waiting for that diagnosis and waiting to get access to that treatment. It could impact outcomes. Research shows us that earlier access to treatment is associated with better outcomes. So any delay to treatment could negatively impact outcomes. And honestly, it's just not fair. This wouldn't occur with medical diagnoses. I can't imagine a world in which a pediatrician would say to a family, I think your child probably has diabetes. You have to go on a wait list, and in about 2 years, we'll find out for sure and get access to insulin. That just simply would never happen for another type of diagnosis. And so we recognize that these lengthy delays need to change. So some of the things that Autism New Jersey is doing in this space is we are coordinating a work group of diagnosticians from around the state, and we meet quarterly to address relevant issues. These diagnosticians connect, discuss novel ways that they have been navigating their wait lists, their patients, trying to continue to improve the quality and efficiency with which we can get patients in and get accurate quality diagnoses. And we are also currently working on developing resources to help support general pediatricians who want to diagnose and better care for their patients with autism. Well, every child has the right to have a specialist, like a developmental behavioral pediatrician or a child psychologist, as part of their team. We also think that our general pediatricians involvement in that team is important, and so we want them to be able to better serve these patients. So as a family member at this phase, what is it that you need to know that may help you navigate these long wait lists and these access to appointments? First, it is important to note that general pediatricians can diagnose autism. Many do not, but it is possible within the scope of their license as pediatricians. You do not need to have an ADOS completed, even if your insurance company tells you that you do. Many insurance companies will require some type of formal assessment and will specifically request the ADOS. This is something that you can push back on. This is something that you can appeal and discuss with your insurance company, and you should not need it, even though you many times will be told that you do. You may have noticed different telehealth apps coming up advertising autism evaluations that have much shorter waiting times. There are pros and cons to these. You can make a decision that's appropriate for you, your family, and your child. Obviously, the pros are that there are shorter waiting lists for these telehealth apps. There's obviously also an ease. Perhaps you live in an area where getting to a diagnostician center is challenging, and a telehealth app would allow you to do this from your home. The cons are they're not always consistently covered by insurance. You should check this out for yourself and determine if your insurance covers one of these apps. And then also, one of the other drawbacks would be this is just the diagnosis. This is not a specialist that's going to remain in your child's care team. So while this may help you get a diagnosis more quickly and get access to treatment, it isn't going to be the start of an ongoing relationship with a physician or psychologist that will be helpful for you as you navigate care for your child. And obviously, it's important for you to remember that as a parent, you are your child's #1 advocate and teacher. The role that you play in every step of this is the most important. And Autism New Jersey is here to help you throughout this entire process. Our referral database can help you find a diagnostic provider. Our website content can help you support your child's development while you wait for a diagnostic appointment and after. Our insurance hub can help you navigate insurance-related questions and concerns, especially around hearing that you may need something specific for an evaluation that you don't have and trying to navigate if that is true or not, or if you need to put in an appeal. We have a Start Here publication and quarterly webinar that can help you before, during, and after the diagnostic process. And our helpline staff at 800-4-AUTISM can help you answer any question you have. Whether you're just starting the process of having concerns and thinking about getting a diagnosis, or whether you've received a diagnosis and are looking into questions around treatment, special education, your different rights and needs that you have there. So just remember, this is a complicated process. It may take some time. You as the parent are here for your child and will do the best that you can and help them. And Autism New Jersey is here to support you every step of the way. Thank you.
Thank you so much, Lauren and Dr. DeQuinzio.
Yes, I want to thank Lauren, especially for providing that information on wait lists and their Autism New Jersey's Timely Diagnosis Initiative. Here's some more information that you can get about Alpine Learning Group. That's the top QR code, and Autism New Jersey, the bottom one, and all of the services that Alpine and Autism New Jersey provide to families. And for more information on this webinar series, Innovations in Autism, scan the QR code here. We have a variety of topics this month geared to families and to commemorate Autism Acceptance Month.
Thank you so much, Dr. DeQuinzio. This was so informative. And thank you all for attending today's webinar. And we look forward to seeing you at the future webinars in this series.